Do you have a child who cannot sit still, constantly moving, talking non-stop, or jumping from one activity to another without finishing? Maybe their teacher says they struggle to concentrate or follow instructions. It might not just be high energy. This could be signs of attention deficit hyperactivity disorder. I'm Dr. Batista, a psychiatrist, and let's break it down together. ADHD stands for Attention Deficit Hyperactivity Disorder. It's a condition that affects how a child pays attention, controls impulses, and manages energy levels. It's not about being a bad kid or bad parenting. It's about how their brain works. Symptoms of inattention may include difficulty sustaining attention in task or play. Often seems not to listen when spoken to directly. Frequently loses items needed for tasks, such as toys, school materials. They are easily distracted, even by unrelated stimuli. Avoids or dislikes tasks that require mental effort, like homework, often forgetful in daily activities. Symptoms of hyperactivity and impulsivity may include mood restlessly, running or climbing in inappropriate situations, talking excessively, difficulty in waiting their turn, interacting or interacting on others' conversations or games, unable to stay seated when expected, for example in the classroom. There are types. The inattentive type is when the predominant symptoms are the inattention ones, or hyperactive and impulsive type when these are the most relevant symptoms, and the combined type is the most common one. These symptoms must be present for at least 6 months and appear before the age of 12 and be observed in 2 or more settings. For example, in a school, at home, and of course, interfere with social, academic, or daily functionings. There are myths like the ADHD is caused by bad parenting. Not true. It's a brain-based conditions. Other one is that only boys have ADHD. Actually, girls may show more inattention and less hyperactivity, so it can be missed. Also, that children just grow out of it. Some symptoms may change with age, but ADHD can continue into adulthood. What causes ADHD? ADHD tends to run in families, which suggests a strong genetic link. Other factors may include premature birth, brain injury, or exposure to substances during pregnancy. But most importantly, it's not the child's fault. Let's talk a bit about diagnosis and evaluation. To diagnose ADHD, professionals obtain detailed history from parents, teachers, and sometimes the child. They check for consistent symptoms in more than one setting, like I said, and for other possible explanations. The management can include behavioral therapy, teaching kids how to manage the behavior. Parenting training is essential. Helping parents learn techniques to guide their kid is really important. Medications can help with focus and impulse control and school accommodation. How you can help is, let me give you practical tips for parents and teachers. Let me start with parents. Set clear and consistent routines. Children with this condition do best when they know what to expect. Use visual schedules if it's possible. Break tasks into small steps. Don't give long or complex instructions all at once. Use positive reinforcement. What does mean? Praise specific behaviors. Tell the kid like a thank you for finishing your homework rather than general praise. Limit distractions at home. Have a quiet, clean workspace for homework or task. Use timers or reminders. Help them stay on track with short, timed activities. Stay calm and patient. Their behavior is not always intentional. About yelling, try calm corrections. Then, in the other side for teachers, sit the child close to the front. Minimize distractions by placing them near you or away from windows or noisy peers. Give short, direct instructions. Break lessons into small chunks with clear goals. Use visual aids and hands-on activities. Kids with this condition often benefit from movement and visual learning. ADHD is more than just high energy. If your child grows up and is having this kind of symptoms and you notice them, talk to a pediatrician or a mental health professional. With support, understanding, and the right tools, children with ADHD can thrive. If this helped you, please like, comment, and subscribe for more parenting tips and mental health guidance. And don't forget, every child deserves to be understood. Thank you.